Hi, this is a nursing professor here. Today I want to recognize that it is Cancer Awareness Day, and one of the cancers that we're seeing a rise in is colon cancer in young people under the age of 50. Now, this is really unusual because our standard has been that we haven't done colonoscopies until after the age of 50. So something's going on to make it start to show up in people under the age of 50. So here's some symptoms to watch out for. Any change in bowel habits. Could have loose stool, could be constipated. But if it's a change of your usual standard, you need to report it to your doctor. If you see any signs of bleeding, that is a sign to report it to your doctor. Any change in appetite, you notice that there's some abdominal pain or abdominal distension, you should report that to your doctor. Because colon cancer is one of the cancers that really does have a high rate of cure if caught in time. And so these deaths that are being reported amongst young people, mainly it's because the testing isn't done until after the age of 50. So I am sure they're going to lower that to 40, 45, somewhere around there. So what else can we do besides the gold standard of the colonoscopy? We can get a FIT kit, which is a little card that you get. It's called a fecal occult blood test. And you just put 2 small little samples on this card. You send it in to the lab tests it to see if there's blood in your stool. Or you can use something called Cologuard, which is where you see the little old man on the commercial. It is a box that's sent to you from the company. You, again, get a stool sample. You actually take a sample from a couple of areas of your stool. You put it in a device. You put a developer in there, and you send it back to the company, and they look at the likelihood of colon cancer based upon genetic testing. And that test is considered to be about 97% accurate. So that's another avenue for you. And of course, the gold standard is a colonoscopy, where prep is probably the worst because there's laxatives that you take in order to make sure your colon is clear. Then they insert a camera into the rectum and they're able to see if there's any abnormalities there and take biopsies. All right. So in the meantime, in between time, please make note of any of those symptoms. If you are a nurse or a healthcare provider, make sure that your patients are aware of that, because something's going on that we can see a rise in colon cancer in the youth. Bye for now, and I'll see you next video.